So my name's Sarah Cook and I'm head occupational therapist in this service. I manage a team in the forensic pathway and also the neurodevelopmental pathway. So we're quite a large, diverse team. We're not only made up of occupational therapists, but we have lots of technical staff that specialise in all sorts of different activities. We've got exercise therapists, education tutors, creative art tutors. I think we're quite innovative and quite creative with, and I think we're all suffering with limited resource, but actually what we managed to do with that resource I think is quite special. The team genuinely care about each other. There are friendships and relationships that support them to maintain a resilience.
This meeting is about Recovery College. It's a hub meeting wherein service users and staff members jointly meet once a month. We basically work together as partners with the idea of co-production. People with mental health issues working closely as equals.
So this is one part of the Recovery Hub. The Recovery Hub is the name for a collection of clinical spaces where our work takes place. So this is Cafe Central. Cafe Central was established about a year ago, and it's a place where service users can develop work skills that will support them when they leave here to take on work positions. They can learn, but also service users can spend time here, and the idea is that this reflects an outdoor space so that it feels like you're in the outdoors.
One of the main things that I do is provide this sort of link between inpatient and stepping out into the community. Kind of challenging when you have those who are not really motivated, but we're patient enough. And I like to think we're all here because we're caring people, and if you're caring, you want to see people do well. Not just with their health, but also with their life generally. So we don't leave anyone behind.
I think the team deserves to win the award.
Because we work with our hearts. It's, to be honest, it's not the easiest job you can do. But we work with passion, with compassion, and with dedication, and that is as a team.
We look after one another, and it's really, really nice environment to work in. So, are you looking for a job?
I'm Dr. Vicky Mountford. I'm Principal Clinical Psychologist at the Outpatient and Daycare Eating Disorder Service at the Maudsley. This team sees people with eating disorders from across South East London and patients nationally as well. We provide evidence-based psychological therapy for a range of eating disorders. We also have our daycare service, which provides more intensive treatment for those patients that need more than outpatient-based care. I think this team should win because it's really worked on transforming care for people with eating disorders, not only locally but across the country.
For one, we've got Mantra, which is a treatment model that we developed here and with the IOPPN, and that was headed up by our lovely Professor Schmidt and the team, and that is now part of NICE guidelines for recommendation of treating anorexia for adults. And then we also set up an early intervention service that's freed, and that is for young people under 25 with a duration of less than 3 years, because like most things, if you get in there early, the prognosis is better. So we redesigned how we worked, redesigned our service, redesigned how we engaged people in the service, for example, like giving them a call within 48 hours of receiving a referral. And then we've got our newest innovation, which is our Peace Pathway, and that is for people with autism and eating disorders. And what we know and what we find is that actually they need something a bit different again. So what we're trying to do is match our treatments, but also tailor them and individualise them for people and what their needs are.
We hold a lot of hope for people, so I think that's something that's really great about the team, in that we kind of have to hold that hope when people aren't quite feeling very hopeful themselves. And we take that kind of approach instead of kind of pushing people up the hill. We kind of walk alongside them, and because if you push them up, they'll just fall back down again. That's why a lot of people leave here and they're kind of ready to kind of take on the world again and do things more independently, because we promote a lot of independence.
This isn't a 9-to-5 job. This really is the true vocation of what vocation used to mean, and it's still very much alive and well in this service. People really care about patients and really care about their families and want to help them get better. And we also all work together and support each other in order to be able to do that. So I've been here a long time and have no thoughts of going anywhere else, because I greatly care about the team here, the work it does, and the care they provide to patients.
So we are at the Michael Rutter Centre, which is basically the children's department of the Maudsley Hospital. And in this building we have all the national and specialist services for children and young people. And it's also home to us, the OCD, BDD and related disorders service. This is a really, really tricky disorder to treat. You speak to any clinicians around the country who treat disorders generally, and very often people will say they get very stuck with OCD. We love that challenge. We spend a lot of time really trying to get to the intricate detail of what the young person is fearful of. And sometimes that's really complicated and you need a lot of dedication to unpick and untangle it. And then once you've worked out what the precise nature of the fear is, then the key is helping to design a really, really powerful task to face up to that fear. And I think that's where the dedication of the team comes in. There is no place they won't go to overcome OCD with somebody.
We've written a number of books in the last year on OCD and its treatment outcomes. We're developing new treatments. We were the first service in the world to do a randomised controlled trial, which is the highest quality of evidence-based trial in an NHS service for treating body dysmorphic disorder, children and young people. It's a really, really common condition for children and young people. Half of the young people who have that condition will make an attempt on their life, so it's a really important thing to get right, and no one had done research to prove what sort of treatment work. So we literally published the first treatment trial for improving outcomes for body dysmorphic disorder in that group in the world. So it really feels like we are taking ideas, examining them and quickly putting them into clinical practice. And our service users and the families are so supportive. The number of letters and compliments that we get back, and we just draw on that.
I was quite involved in the assessment process, seeing new patients who are being assessed for suitability for the team. And in every assessment I felt that the actual assessment itself was a therapeutic sort of space in which patients felt more able to tackle their OCD because they were instilled with hope. Not just because the treatment is really effective, but also just because of the warmth and friendliness of the team members speaking to the children. I think in many cases they hadn't encountered that before, that feeling of hope that they could completely get rid of their OCD.
In all honesty, what makes it such a special working environment is that every person on the team is really equally dedicated and committed. We're all in it for the same reason. We all want to achieve the same thing, which is to get these young people better. And it's so rewarding to hear when a young person's gone from being housebound to getting their lives back. Unbelievable, and we all sort of celebrate in that equally.